I'm Mike Royer with an extended interview in this Health Matters Web Extra. Dr. Jane Weida joins us again on Health Matters. Dr. Weida, it's a pleasure to see you again.
Thank you. It's good to be here.
This segment we're talking about today is one that started with a conversation we had. I shared with you that my doctor retired on me and I had to find another one. That's a challenge for people. You deal with senior adults. As you get a little older, if your doctor's a little older, you lose them. Is this a common concern that you hear from patients from time to time?
Yes, we especially hear it in the residency because those doctors are only there for 3 years and then they have to turn the care of someone over to another doctor. But I find that my patients have generally changed a little bit as I've gotten a little older. So I find that most of my patients are women. That's always been the case, but now even more so. And they tend to be about 40 to 80-year-old women. When I was first in practice, it was younger women and very few men, and even fewer men now. I think older men just prefer to see a male doctor, and that's perfectly fine. You need to find someone that you click with.
We need to be comfortable with our spouses and with our pastors or priests or whatever. We need to be comfortable with people we go to and see, but none more important than your physician, because you're sharing as personal of information with your physician as you can. So you're not offended that a man might, I think I'd rather see Tom Weida. That doesn't offend you in any way. You understand that.
Not at all. And in our practice, where we have a lot of doctors, if I have a patient who's a male and he wants to see a male doctor, that is fine. I want you to be comfortable with your medical care, and I want you to be comfortable with whoever you're entrusting your deepest, darkest secrets with.
I've shared with you too that in my age group, when my doctor retired, his daughter took over, and I remember her as a little child, and where there was a mental block there for me, you can understand that as well.
Of course, of course.
I wonder though, some of those young doctors will say, you should go to a young doctor because we're up on the very latest and all of this. I find that middle-aged doctors and older doctors are keeping up with stuff. I'm not sure that's a great argument. Do you have an opinion on that?
Well, it probably used to be a great argument, but nowadays where there's so much information and continuing education for everyone, everywhere, on the web, in person, and we have a certain number of continuing education hours we have to take each year, we all have to keep up. It's important. New medications, new diseases, Ebola, COVID, things that we didn't know about 10 years ago. Yeah, we all have to keep up.
Let's end with a non-medical question.
Sure.
My doctor that I used for 35 years who retired, I loved him. He talked so bluntly to me. He didn't even talk to me like a doctor. He talked to me like my friend. Isn't that personal relationship one of the most important things if you establish a long-term relationship with your doctor or doctor with patient? Trusting each other, liking each other, maybe even loving each other as a friend is not a bad place to be at all.
That's absolutely right. You do need to trust your doctor. Now, you might disagree with what they say, and that's perfectly okay. If you don't want to take their advice, make sure you tell them, because if they think you're taking a certain medication and you're not, and they add another medication because your blood pressure still isn't under good control, you need to be honest with each other.
It's not possible to over-communicate with your doctor.
No, probably not, unless you take too long in the exam room.
Then that's a problem.
Right.
Dr. Jane Weida, thanks for sharing a more personal interview with us about comfort levels with doctors. We appreciate you. Thank you.
Sure, glad to be here. Thank you.